homicidal and accidental wounds in general. Again, it is only for your general knowledge. Generally, they never ask in the examination. They never ask in the examination. Okay. Treat suicide, homicide, accident. It is only for your general knowledge. In case of suicide, usually the wounds will be incised wounds or stab wounds. But homicide, usually chop wounds, lacerations or stab. Okay. Not always. Okay. And accidentally, usually lacerations, abrasions and contusions. It is only for your general knowledge. I told you. Number of wounds. Suicide, multiple. Multiple means include hesitation cut, say for example, cut wrist injury. Homicide, maybe solitary, but multiple, slashing a person multiple times. But accident, accidental stab wound or accidental cut injuries, it is usually, in that case it will be single, but in case of road traffic accident where a person falls over the ground and he may sustain multiple injuries. Okay. Target areas in suicide, always person make incision for the easily accessible parts of the body, like that is front and sides of the body, like neck, wrist, left side of the chest, groin, etc. Whereas homicide, can't see. Okay, no fixed site. Vital parts, especially if they really want to kill a person, they will cause injury over the where vital organs are situated, like head, chest, abdomen. Accident can't see anywhere, and especially on exposed areas and bony prominences. Okay, and grouping of the wounds. Suicide, it is somewhat arranged. Say for example, cut is continuous, only one area, it is arranged like. Homicide, anywhere, irregular. Accident, vulnerable parts. Say for example, if a case comes with the history of road traffic accident where the person rider, he may falls over the side, he may get the grazed abrasion, may get injuries over one side of the body, or there may be lacerated wound on the head, all such things. Okay. Now, see, in case of antemortem wounds, when the blood clot is formed, the blood clot is seen in and around the injured areas. The clot is laminated and firmly adherent to the lining endothelium by lines of Zahn, that I told under medico-legal autopsy, how to differentiate between postmortem clot and antemortem clot. Okay. Because of the fibrinogen, the clot is rubbery and firm. Okay. At the same time, it will be elastic. It will be elastic. Okay. At the same time, in case of postmortem wounds, blood may not be clotted so easily. Sometimes it may not clot. And if at all you see the clot, it is non-laminated and it is not adherent with the lines of Zahn. And clot is very soft and friable. Soft and friable because there is no fibrinogen. Okay. And if you hit the clot, it breaks out easily. And in case of postmortem clot, what happens is all the blood cells will come and settle on the dependent part of the clot, which looks like red currant jelly. We call it as red currant jelly. Okay. Whereas the upper layer that is made up of serum, which is called yellow chicken fat. Red currant jelly and yellow chicken fat appearance. Okay. Okay. And if you examine microscopically, you can see the fibrin, platelet and RBC in the clot. But in case of postmortem wounds, it is mainly composed of only fibrin and RBCs. Okay. mainly composed of fibrin and RBCs. There is no platelet in case of postmortem wounds. Okay. Vital reaction. Vital reaction. Signs of inflammation and repair are demonstrable depending upon the age of the wound or injury. And also you can see the color changes in case of bruises. Even abrasion also I mentioned, how it heals. Okay.